I've asked Dr. Pat Basu to join me. He served as a White House Fellow, America's most selective and prestigious program for national leadership and service. He's also served as chief resident at Stanford University. He is now the chief medical officer of Doctor on Demand, the company that my son Jay and I have developed. Dr. Basu, thank you for joining us.
Good morning, Dr. Phil. Thanks for having me.
First off, what can you tell us about these substances, Kava and Kratom?
Now, Kava and Kratom are unregulated substances, so the FDA has not done the proper studies on the safety and efficacy, and most importantly, they have no oversight over the concentration of doses.
Are there dangers associated with ingesting Kava? Let's start with that.
Absolutely, and again, the danger with Kava is a little bit because we haven't, as a sort of society, and the FDA has not done that many studies on it. A little bit is the unknown, but what we do know is the dangers, first and foremost, are at the liver. So begins with hepatitis, with this inflammation of the liver, and then cirrhosis, which is kind of a more severe process before it would progress to frank liver failure. The second organ that gets damaged with Kava ingestion from what we've researched is the kidney. So you get kidney damage, you can start to see blood in your urine. And then secondary organs that, there's some differences in the body are damage to the skin as well as to the lung. And finally, there's evidence that this causes some pretty significant weight loss as well, unhealthy weight loss.
All right, and how about Kratom tea? I understand there you're seeing problems with respiratory depression, hallucinations, delusion, psychosis, and then real serious problems with mood swings and other things.
Yeah, that's correct. The respiratory depression and the psychosis and hallucinations are definitely the most well documented and the most concerning, but absolutely the insomnia and the significant weight loss are all a part of that multi-organ system damage that we see with substance abuse.
What happens if someone is mixing substances, if we're talking about nicotine, Adderall, alcohol, Kava, Kratom?
The drugs you just listed off there, we have a handful of stimulants, we have a couple of depressants, and then we have these two unregulated substances, which we've alluded to earlier. That cocktail, that mix is frankly, the damage is exponential. And in this case, I'd be worried about multiple organ system failure. And frankly, if the doses are high enough, even death could certainly be a possible outcome here.